It's very important to realize that not all strokes present the same way. There are very subtle differences from one person to the next. Nutrition, exercise is amongst the highest priority of things that the younger population can do to prevent themselves from ending up with a stroke. The important thing is, if you're working with your primary care doctor, have a good physician that you have connected with, and know what your baseline health is and what your risk factors are, then when something that shows up or comes up in your health status, such as a change in mental status or weakness on one side of the body, it can send you a red flag that you need to go and obtain help and evaluations. I recommend patients starting young at the age of 15, get established with a primary care doctor, because at a young age, this is the time where we can really intervene and change the process that takes place in one's life. Transient ischemic attacks, which are also called mini strokes. The CDC has also stated that these statistics for these patients are the following. More than a third of the people who've had a TIA and don't get treatment, in 1 year they have a major stroke. And as many as 10 to 15% of people that have had a major stroke had a prior TIA in the previous 3 months. So it's very important to make sure that one yields the signs of what their body is, but how their body functions on a normal basis, and what their physical and emotional features are. Because when they see that there's a deviant track from where they normally are at their baseline, it's very important for them to get healthcare evaluation to ensure that they're not having a stroke. So the myth that you cannot readmit for difficulties from a stroke and reobtain rehabilitation is completely false. Like I said, brain injury is a lifelong disease process. Yes, recovery does happen over time, but no brain injury can be treated the same. I have a patient that I've seen 1 year ago had a brain injury and came to me after discharge doing quite well, but then all of a sudden started having behavior issues and lashing out at his family and loved ones, and wasn't really sure what was going on. So the myth that you cannot find help again when it comes to your ailments related to brain injury is false. The minute that there is some subtlety or change from your baseline, there is no shame in going back to get help or visiting with your doctor to see what can be done to get you back rehabilitated with those weaknesses that have shown up. I think at the Center of Neuroskills, I pride myself. When I started with this organization several years ago, stroke management has been ever changing. It progresses very quickly as new technologies are coming out, new ways of treating strokes are coming out. One of the approaches that we take at the Center of Neuroskills, and something that I hold very dear, is whenever a patient comes to me, the first question I ask them is, why are you here? And this really dissects down to the point that if the patient has had a stroke, well, why have you had a stroke? It's our job as the medical team to make sure that we ensure that this patient is not going to have another stroke, at least minimize the risk factors. So it's very important to be part of a medical team process where they can evaluate exactly what's going on with you medically, minimize any risk factors that could potentially cause you to have another stroke, and really set you up for the future